This video introduces the clinical application of a toolkit designed for equity practice. It is an applied resource for inclusive teaching, facilitation, communication, and care in integrative healthcare, created by Dr. Charles Chip McNeal. When a doctor demonstrates empathy by sharing his previous work, it illustrates his deep commitment to family practice, personal values, and equitable healthcare. The impact on his patient can be substantial as it builds trust and connection between doctor and patient. Shared values are core to equity practice. Compassion, dignity, kindness, and openness are essential. We all share these values, yet the challenge is to put these values into action and everyday practice.
Understanding the historical foundations of medical inequity, such as practices in gynecology, forced sterilization, and the Tuskegee syphilis study, is essential for progress. These sad events have a lasting impact on marginalized populations and contribute to a lack of trust. Knowing this, healthcare providers can intentionally create a more trustworthy, belonging atmosphere.
Clinical teaching can be equitable clinical culture in action. The toolkit helps clinicians integrate inclusive principles into everyday settings where care is both learned and delivered. The toolkit serves as a bridge, strengthening the clinical learning ecosystem across 4 domains: learner experience, patient care, team communication, and professional practice.
The toolkit emphasizes balancing safety, rigor, and belonging for learners, helping people navigate tensions like authority and identity. Medical students need and want to trust the learning experience, and an equity perspective can help. Remember, their doubts and concerns mirror that of any adult learner. Effective team communication is a patient safety practice. This framework supports structured, accountable, inclusive, and actionable interactions between caregiver colleagues. When we invite disparate voice, we are able to see things we might not otherwise notice. Colleagues also support accountability, following up with constructive feedback and shared ideas. In patient care, applying cultural humility and curiosity helps clinicians better understand what matters most to their patients and identify hidden barriers. This perspective quells assumptions and invites probing questions about context, challenges, and concerns of the patient. A patient's context matters. A clinical equity lens provides a diagnostic frame for teaching and making rounds. Critical prompt questions can act as pause points to ensure equitable care, revealing hidden elements that influence recommendations and the plan of care.
Compassionate care is fundamental to the clinical experience, placing humanity at the center of the treatment process. Integrating medicine and humanity, compassionate care offers tangible benefits like improved patient outcomes and reduced burnout for caregivers. We must recognize the dissonance of encountering systemic obstacles to equitable, inclusive care. Change systems when you can, but focus on what's under your control. While heavy workloads and emotional fatigue pose challenges, the data confirms that compassionate care is better for everyone, as it lowers costs and fosters professional resilience.
The concept of patient-centered care takes into account critical factors like economics, access, time, and trauma that impacts patients. It also emphasizes building trust through transparent, honest, culturally responsive communication. Trauma-informed care, or trauma-sensitive care, is essential for ensuring that every patient interaction is supportive, respectful, and empathetic. Trauma-informed care is grounded in the 4 R's: realize the widespread impact of trauma, recognize its signs and symptoms, respond by integrating culturally informed knowledge into practice, and resist re-traumatization of patients, coworkers, and staff. These 4 core pillars of trauma-informed care take time and intention to implement, but yield impactful, lasting results.
Updating equity practices requires operationalizing bias suppression. This includes redesigning intake processes, auditing forms for hidden barriers, becoming knowledgeable about intersectionality, and redrafting rules, processes, and documents with an equity-focused lens. Intersectionality is key to addressing systemic equity gaps. We use frameworks to understand multiple identities in the understanding of oppression. Researchers should also disaggregate data to uncover hidden issues, acknowledge personal positionality, and eliminate harmful institutional norms. Remember, one can't really know the entirety of who a person is in just a few minutes' time. Everyone is part of many groups and multiple identities. Cultural humility fosters stronger therapeutic alliances. It requires a lifelong commitment to self-evaluation, non-paternalistic partnerships, and an asset-based approach that values the cultural background of every patient. After all, equitable healthcare is a collaboration. These key concepts remind us that we must be respectful, accurate, and thorough when we reference disparate cultures and health practices. Epistemic humility and medical pluralism are foundational in this toolkit. Negotiating these ideas can reframe work so that it is historically accurate and culturally responsive. When doing research and medical studies, including communities as advisors and liaisons can not only improve response rates and participation, but ensure that blind spots of the study are revealed. Continued exploration of the clinical application of these concepts helps align organizational values with equitable practices. The toolkit provides specific, strategic, practical, equity-focused strategies within the health research environment. Be reminded that research with people trumps research about people. Reflecting on moral injury is essential. When systemic constraints force difficult choices, clinicians must differentiate emotional exhaustion from moral injury and work to transform the systems that create these conflicts. Collaborate with a supervisor, colleagues, or the board of directors to revise outdated material and update clinical practices. Moral injury occurs when actions and policies contradict deeply held values and beliefs. By addressing acts of omission and leadership betrayal, we can better support workforce well-being and maintain professional integrity while improving patient care.
Transformation begins with reflection and adoption of new habits of mind. These ways of thinking can indeed become habit. As noted, our personal and professional lives are connected, and true change requires consistency in how we interact with others. An equity perspective will undoubtedly influence every part of your life. When in doubt, act as if. Adoption of these principles requires change. This transformation is the art of becoming your best self in the context of your work and your life. Rather than fear change, one must be bold and courageous, knowing you are contributing to create the world we all deserve. Please use the toolkit in your professional development, your teaching, and your clinical practice. But please do not distribute, share, alter, or edit content without consent. Always credit the author. To cite this work appropriately, please refer to the documentation provided, which outlines the comprehensive equity practice toolkit prepared by Dr. Charles Chip McNeal of McNeal Consulting, LLC.
This toolkit was custom prepared for the UCSF Osher Center for Integrative Health and the Osher Collaborative. The concepts are generalizable, but every context is different. Reach out if you are ready to develop a comprehensive resource focused on whole person care. It is never too early or too late to strive for justice, equity, and inclusion. Thank you.